Hi, this is Dr. ZBerry, part two of talking about how we can make that transition between the departments in order to pass the baton for clinical outcomes, and it actually ends up on that schedule. So it starts with the front desk, of course, when the patient comes in and they're coming in for their hygiene checkup or their new patient they're establishing. And that first point of contact is something that is communicated very well and politely with customer service in mind. Then the next step is actually getting them into the clinical area for the hygienist to do their part. And their introduction and how they proceed forward as far as getting the clinical data for the patient and the doctor available so that everybody's on the same page. Taking the x-rays, the perio charting, the diagnosing of what the perio charting is, and making sure the pictures and your x-rays, everything is laid out, but there's an opportunity for the hygienist to sit down and make sure they can zone in on something that they see that's wrong. So say if the person has a tooth that is, needs some clinical procedures, and the hygienist then will identify in the picture, which is the photo, and then the x-ray to kind of lead them to understand that there's a problem with this tooth, which makes it way, way more easier, you as the doctor coming in order to zone in on that same information so that the patient understands there's an urgency for us to be able to treat this tooth and why is it necessary for us to go to the next step. That is the first part of passing the baton. Come back. Dr. ZBerry for Dental Leadership Academy. Part 3 is coming.